Hello, I'm Jim Roberts. I'm one of the co-hosts of Senior Living in Alexandria. This is a monthly program that we provide to seniors and family and friends in Alexandria as information that seniors can use in terms of programs and possibilities that might be available to them. My co-host is here tonight with me today with Mary Lee Anderson, who's the Executive Director of Senior Services in Alexandria. And we've got a special guest in many ways that you'll learn over the course of the program. This is Mitch Apolsky. He's the CEO of Synergy Home Care. And it's a remarkable organization that provides services to seniors. And I'm eager to hear what some of those will be. But first, let's turn to Mary Lee. And Mary Lee, tell us some of the events that are going on in senior services, if you would please. What's going on?
April, we have an event coming up on April the 23rd that we're co-hosting with the Nova Alexandria Hospital.
Okay.
Our speaker series event and the annual Health and Wellness Fair will be at the Lee Center on April the 23rd. And we hope that lots of people will show up for that. We're talking about the 5 senses and aging, and also we'll have some workshops, cooking demonstrations, blood pressure and hearing screenings, all kinds of good stuff going on there. So we're looking forward to April being another productive month.
There's always something going on at Senior Services.
There is, you're right.
But let's turn to Mitch. Mitch, as I understand it, a lot of the programs we talk about on this show are for seniors, but we always try to include the fact a senior doesn't age by themselves. It's never in isolation. They're family, friends, caregivers, service providers, et cetera. And I think that's the sphere in which you have been very active and very prominent. So if you tell us a little bit about Synergy Home Care, and tell us, first off, how did you get into it, and then what do you do, please?
Great. Well, we've been providing home care services here in the community for the last 6 years.
Okay.
And prior to that, I worked for the National Trade Association, the National Association for Home Care and Hospice. That's down in Washington. And I was there for 7 years, and that's where I learned all about home care, and I grew a true passion for it.
Okay.
And when I was ready to move on, to something different, I decided to become a provider of home care in my own community, where every day I can help my neighbors. And that's truly the way I look at it, because I've lived in my community my whole adult life. So now the people that I'm helping are the people that I live with, and I feel like I'm really bettering the community and helping people to age in place.
Mm-hmm. So the idea is to provide help to seniors and their friends, family, et cetera. And how does that work?
Well, it is a group effort, as you said. We see ourselves as part of a care team, and there usually are family members involved, friends, neighbors, and to help the folks with aging in place and to live at home safely and independently as possible with whatever help they need. And as their needs grow, we can grow with them.
What are some of the kinds of needs they have? I mean, transportation, medical, financial planning, food, clothing, shelter. Is it the gamut of those, or do you specialize in things?
We do. We specialize in the world of non-medical home care. So we don't have doctors and nurses that come into the home, but we have home health aides and nursing assistants. And there's the 3 areas that we focus on: personal care, and that's help with the activities of daily living, the bathing, dressing, grooming, toileting, eating and drinking, and safe transfers in and out of bed. And then the next level we call homemaker services. And this is a tremendous asset because our caregivers can help with everything from light housekeeping to meal preparation, laundry, which is kind of a bonus because most of our cleaning companies don't do laundry. And while they're in medication reminders is another big area where we provide service. And then you touched on one, Jim, transportation. In fact, 2 of the most commonly requested services that we get these days are, number one, can you come in every day or a couple times a week and prepare a nice home-cooked healthy meal for my parents? We've noticed they're not eating nutritiously anymore. And that's important because your health is going to surely decline if you're not eating nutritiously. And secondly, the transportation. Why? Because a lot of our clients are in their 80s, 90s. They're not driving anymore, and rightfully so. And so they say we want to keep them at home, but can someone come and take them to their doctor appointments, to the grocery store, and sometimes just on social outings, go down to the museum, go to the movies. So
I think I understand how this works. So I'm an elderly person, I have a need, I call or get in touch with you, and do I have to be a member and be known to you, or is anybody that has a need could call and you're able to find, and then you respond with, sounds like a whole smorgasbord of services that I mean, that's a undertaking in itself, just to organize those services with qualified professionals provided in a timely manner. Is that the essence of how it works? How do you work with your?
yes, you contact us by calling us on the telephone, or actually even through our website you can initiate service.
Okay.
The baby boomers are tech savvy and they might like to go on the website and fill out the form. It comes to us and we get on the phone and call them. But the telephone is the usual method that we hear from our clients, and it could be through the hospital if our clients are coming home from the hospital and need the care there,
Okay.
or it could be in an assisted living environment. See, we provide service wherever our client calls home. So when you think of home, you're thinking of a single family residence, but we provide service in apartment buildings, condos, assisted living facilities, nursing homes, and even in the hospital. If anytime someone needs an additional help, additional what we call one-on-one care, we can provide it no matter where they are.
Do you do single events where we need help one time, or do you have ongoing relationships, or
We do.
is there a variety of those?
And that's a really good question, and we want the community to know that we are so flexible in the way we provide our service that we could do short-term care, long-term care, and anything in between. And so a lot of our services are focused on recuperative care. Somebody is recovering from a joint replacement and they need us for 3 weeks. They're coming home from the hospital back to their residence and they're weak and they're a fall risk, and we may be just with them for 48 hours while they get back on their feet. So 4-hour minimum is all we ask for our visits, and 1 time a week is fine with us. So we'll help a little bit or we'll help a lot.
So a doctor, for example, could say, I recommend that you do this. You should be in touch with Synergy, and they will then call you and engage your services. Or a family member might find you and say, I need this for mom or dad, and I need to do that. So word of mouth is important, and the knowledge that you provided prior service sounds important.
Very much so. Our referral sources are facilities like nursing homes and hospitals that are discharging their patients back home, and then others come directly from the community, families that are being proactive and planning for care for their loved ones as time goes on, or they may find themselves in a crisis, in the home setting, and go on the internet and search for home care agencies, and hopefully Synergy comes, at the top of the list.
What's the business side of it? How, if I engage you and I need, my mom needs somebody to come in 4 hours, 3 days a week, and I've engaged your services, what should I expect, or how does that work?
Well, we tailor our services to the client. So when you're ready to sit down and talk about the starting service, we will come out to the home and we'll do a free in-home consultation. We'll explain the smorgasbord of services, as you put it, and we'll tailor them to exactly what our client needs. And we document that in a care plan, and that becomes a living document because people's needs change, and they can change overnight. So we change with them, and that's how we get started and know what services we should provide.
How do you organize the array of services? I mean, that's a major undertaking, just to know, yes, we can do that, but there's a promise behind that, and you must be very good at being able to do that.
Well, it all boils down to communication with our clients and our family members, and we're good at that at Synergy Home Care. We have to have a lot of back and forth about how are things going, are you happy with the services, do we need to add anything, do we need to do something better. So our quality program is pretty robust with phone calls and face-to-face visits to our clients.
So you get feedback from that, and it tailors your services. What's an example of how the process works in your own personal experience, maybe in terms of what kind of call, what happened, how much time, how did you measure it, what was the aftercare? What kind of example would you have?
Okay. Well, a very typical one would be a call from the hospital, and it's probably a family member saying, you know, my mom just had surgery and they want to send her home tomorrow, but they recommend that she have somebody stay with her at the house and help her out with her bathing and prepare her meals because she can't be on her feet for 3 days. And so we'll come to the hospital and we'll get that whole care planning process going and figure out what services they're going to need. And then we want to make the right match with the caregiver. That's a very important part of this process as well. So we'll talk to our client and the family members about what type of person they're going to get along with. Does age make a difference? They want a male or a female, and so on and so forth. And then we'll make that match with the caregiver to the client. And once the client comes home, we'll start service. And what else goes into the determination? How many hours a day do we need to be there? Is it the 4 hours? Is it 24 hours around the clock? Because we provide service 24/7, 365 days a year.
Okay.
Yeah, we're always available.
Now, I understand you serve Alexandria, of course, but you serve a wide, I hear your offices are in Arlington down the block, and we could walk over there and say hello after the show.
Correct. We are right down the street, and we service all of Northern Virginia,
Okay.
even parts out to Fairfax, but certainly cover Arlington, Alexandria, Falls Church.
Well, that's an outstanding service. I think the fact is custom tailored speaks well to the need and your ability to fill it. We're getting a little close to take a short break. Sit tight.
Hi, I'm Mary Ann Beatty with Senior Services of Alexandria, and I'm pleased to be with Steve Nelson and Grace Crawley, who are going to give us a demo on pickleball. It's the latest senior craze, but before they get started, I'd like to learn a little bit more about pickleball myself. So Steve, first of all, tell us who you're representing within the city, and then tell us a little bit about pickleball.
Well, the City of Alexandria has two great rec centers that have court time available. One is the Nanny J. Lee Center, and the other one is the Charles Houston Center. And on certain days of the week, you can go down there, and the courts are set up, play pickleball. And it's for seniors, and I'm a volunteer. Grace here is a volunteer coordinator at the Lee Center, and it's a super game.
And that's great. So Grace, tell us a little bit about pickleball.
We're now going to hear from Mary Ann Griffin, who's with the City of Alexandria's Division on Aging, hear what she has to say, and then we'll come back and wrap up this show. But thank you very much. That's very helpful to know what Synergy does.
Hi, I'm Mary Lee Anderson, Executive Director of Senior Services of Alexandria, and I'm here with my colleague Mary Ann Griffin to talk about the services that are offered in the City of Alexandria for seniors by the Division of Aging and Adult Services. Hi, Mary Ann.
Hi, Mary Lee. Nice to see you.
Nice to see you too, as
Thank you.
always. So tell me a little bit about yourself and what you do at the division, and then what the division does in the city.
Well, I've been with the city for 10 years as the division director and have a background in gerontology that goes back many, many years before that. The city has consolidated all of the publicly funded services for aging and people with disabilities into our division. And we have 7 major programs. We have the home and community-based services such as Meals on Wheels that we contract with Senior Services to do. We have an employment program. We have adult protective services. So we've really covered the whole waterfront in terms of the services that are available to the seniors and people with disabilities.
And about how many seniors do you service in Alexandria?
It depends on which program. Probably all told somewhere around 5,000 people. That includes people who use our transportation and people who get Meals on Wheels and people who go to our community, our congregate meal sites in the community. So about 5,000 people altogether.
And I think a lot of your programs are managed, and the services that you provide are through an extensive social worker system. Is that correct?
Yes. The services under Adult Protective Services and Adult Services, which is case management and companion services, all of the people who work in those two divisions, as well as geriatric mental health, they are all master's prepared social workers, MSWs, and there's a PhD psychologist as part of that group. So the direct hands-on employees of the city that provide that are in those three areas are all professional social workers.
And those services, social worker services and that type of thing, are those offered to all citizens, or is there an income requirement, or how does that work?
Well, I think that's probably one of the biggest misconceptions about the services in the city, because I think people tend to think, oh, it's government, therefore you have to be poor.
Right.
And indeed, that's actually not the case. There's only 3 out of the 12 or 13 programs that we have actually that have an income requirement. And the reason they have income requirements is because money comes from the Administration on Aging and the federal government, money comes from the state, the Division of Aging at the state, and within those 2 parameters there are income requirements. But certainly adult protective services are not income based. With the geriatric mental health, those are not either. I mean, if a waiting list existed, we probably would give priority to people who didn't have another option, but there is not an income limit for those. And with the adult service program, we have universal access to case management, so we have master's prepared social workers. Anybody can call us on the phone at any time. Families from out of state, families who live here, seniors themselves, and we will do, if it can be done on the telephone, it will. Otherwise, we will make a home visit and make an assessment and then help to refer them, because we are, the federal government has designated the Area Agency on Aging as the No Wrong Door Aging and Disability Resource Center. So we're the, one-stop shop, go-to place. The other program, though, that is in adult services that does have an income limit is the Companion Aid program, and that's a non-skilled program for light housekeeping, grocery shopping, and that sort of thing, which we think is really vital to help keep people in their homes. But that's partially funded with the Virginia Department of Social Services, and as a result, it is low income. It's 50% of the state median income, and that's about $1,300 a month or so for an individual.
Sure. Can you talk a little bit about the transportation program that you have? I'm familiar, of course, with the transportation program for the disabled, but I know you have the senior taxi program, and also something that I'm always trying to get people to learn about and take advantage of, and that's the door-through-door program.
Yes, be happy to. Well, the first thing is we actually run our own transportation. We run group transportation. We have 2 28-passenger buses that run all day, every day, taking people to the senior centers and shopping, etc. And as you mentioned, there is the senior taxi program, which has changed dramatically in the past year, and basically is now called, I think, the Yellow Card program. But it is available to people in the city whose income is less than 60% of the city's median income. We subsidize basically vouchers for them, and people can go anywhere they want, any day of the week. They have X amount of dollars to spend every month. I mean, every quarter, I'm sorry. And then they renew every quarter. And while that's different than it had been before, it offers a lot more flexibility in terms of being able to go any time of the day or night, anywhere. A program that is dramatically underutilized, unfortunately, is called the Door-Through-Door program. And that is a joint program with the Arlington Area Agency on Aging and a home care agency in DC called Home Care Partners. And it's a federal New Freedom grant that we got a couple of years ago. And basically what it provides is it provides accompaniment of a certified nursing assistant or a home health aide if someone has a medical appointment. And because it's both Arlington and Alexandria, anywhere within a 10-mile radius of either of those to medical appointments, and there's no age requirement. So what's available is that the person will contact the home care agency, and we certainly have that number, and they will make arrangements, and the certified nursing assistant can go to their home, help them get ready, get into the taxi cab, go with them, come back, help them get ready, get lunch, whatever, but 4 hours, and it's completely free.
I know, it's a
And
wonderful service.
It's a wonderful service,
Yeah.
and we try our very best to make people aware of it, that it exists.
Well,
but-
that's why I wanted to make sure we mentioned it,
Yes.
so we get the word
well,
out.
and you know, even though it certainly any age can use it, I think it's very beneficial, particularly in the case of seniors, because what it means is that an adult daughter or son doesn't have to take the afternoon off to take mom
Right.
to the grocery store.
And they have to provide, or they pay for the transportation
Correct.
itself.
They pay for the transportation themselves. If it's someone who's using the DOT paratransit program, if the aide can ride free as accompaniment, but if it's any other form of transportation, they would have to pay, for example, the taxi fare for both
Right.
themselves and the aide. But otherwise, the aide is free.
But
And
4
home-
hours of an aid is
4 hours. That's exactly
a lot.
right.
Yeah.
It's a lot. And so the agency would even help them coordinate with the doctor's appointment when someone was available. So it's a very, we would love to have it more readily used than it is right
yeah.
now.
Well, good. I hope we get some more people using it.
Thank you
because
for
they've
bringing
heard,
it up.
Sure, sure. So let's talk about how we work together, Senior Services and the division. I know we do an awful lot of things together. I'm not sure everyone else knows how much we do.
Well, we certainly contract with Senior Services to provide the Meals on Wheels program, and that's enormously helpful. And I don't mind talking to Mary Ann Beatty at 5:30 in the morning. She'll be doing meals on that given day. But I think the other way is really the collaborative. We've certainly done the resource corners together and get out into the community and do a lot of joint presentations. And I think that's really advantageous for both of our agencies because nobody can do it all. So
Yeah.
I think being the not-for-profit working with the city staff, it's been beneficial, I think, all the way around.
Oh, absolutely. I mean, I really enjoy working with your staff, and the cooperation, I think, between the two organizations is really great to see. You want to see city organizations working together as a
Yes.
team. So I know we often are try and make sure that we have people from the Division of Aging on the panels for our speaker series events, because you just have such a wealth of knowledge, and getting the word out is what it's all about. So what else do you want people to know about what you guys do?
Well, I think probably one of the newest programs, and we haven't really had an opportunity really to promote it much, is the Experienced Worker 50 Plus. I mean, we've both worked on that together, but it's up and running. It's a totally, hard to believe, but totally free program, and we're really gearing to people who are over the age of 50, because we know ageism is alive and well in the workplace, and people who've retired and then find out that they don't have sufficient income to stay retired, people who are retired and bored, etc. So we've created a sort of one-stop shopping through JobLink, which is a city employment program, and it's sort of a soft handoff. It's meeting with one individual and then being able to transition to one employment training counselor. And we actually have seen 63 people since May, and we've about 25% of them so far have gotten jobs. And I think that the key here, because a lot of older people have never applied online, they have no idea how to do that. They don't understand the use of social media. So we've had a LinkedIn class, and we brought people in to do transitional workshops to understand, how to frame it. You're not unemployed, you're in transition.
Right.
And so it's just, I think it's I've been very, very pleased with how well utilized it is. And I think, again, that goes back to our shared resource corners. Most of the calls have come from the library senior corner. So I think our outreach has been effective. Collective outreach has been very effective.
And we really do want to thank the library for starting that program off. And we now have 12 senior information corners around the city that we stock with literature about services provided by the Division of Aging and others. Well, I want to thank you for being with us today. It's
you.
always
It was
a
a
pleasure to
pleasure.
be with you.
Thank you.
And look forward to working with you on some future programs.
Thanks.
Thanks.
Welcome back. We've had a lot of information tonight from Mitch Opolsky of Synergy Home Care, and we also heard from Mary Ann Griffin from the City of Alexandria Division of Aging. We've learned a lot tonight, and I want to thank you very much for coming. I want to close with highlights for the March speaker program for seniors. I'll turn it over to Mary Lee to fill us in on what to expect, please.
Well, we're going to see highlights from the March Speaker Series event, and then in April, coming up, is our 5 Senses of Aging that we talked about earlier.
Out of those focus groups, we came up with our Power Plus. You like that? Power Plus 55. So we have a couple of publications out right now. One of the other things that came out of focus groups was to have a publication for our older Power Plus folks. So we did come up with a small publication that lists our locations and our activities and fees and things like that. So that's the small brochure. And then, of course, the department has a full brochure, and this is the spring summer. It's new, it's out now. These are no longer mailed to every household. Hopefully you know that by now. It comes out 3 times a year, but it's online, it's at libraries, it's at recreation centers. You can have it mailed if you go online and request that, or you call us and request it. You can get it mailed, but it doesn't come automatically like it used to.
Now we have robust aging, and so you'll see on the flyer that we have a 3-part robust aging program for recreation, park, and cultural activities, and Margaret Orlando is leading that charge. And at the beginning, Nellie J.B. across from the center at Kelly Cares Miracle Field. And the first session will deal with balance and mobility testing, and then show you how to fall. Because I think it's fine and dandy to learn how not to fall, but once you're falling, you have 2/10 of a second to decide your strategy, making the transition from the standing to the ground. And if you haven't prepared, well, probably not going to do very well. But you can definitely learn how to fall forward, sideways, and backwards. Take it from someone who's probably fallen more than most people in this world who are activity level. So we have that as the first session. And then the second one is the robust walking, where you learn how to weave calisthenics, different types of exercises into your walk. And we show you also how to walk with good form. And after this session, sit-down session, if you'd like to join Mark on the nature trail, we'll be taking a walk, and I'll show you some of the rules you can use while you're walking. And finally, the last session uses Tubix. And Tubix comes from, I never thought I'd be doing this so many years later, but this was back in the 80s, where I did a book down in Charlottesville called Tubix. And it's using a bicycle inner tube for exercise. It was an Air Force fighting stick, and it weighs 7.7 pounds, the same as the M4 carbine. And I thought, well, for the seniors, this may be a little heavy, a little cumbersome. And so we came up with something that's also filled with sand. Excuse me, sir? We call this, for want of a better name, sandbar. And so this is something in the last session I showed you how to use the inner tube and how to construct a sandbar.